Right, if I could introduce, in no particular order, Vonda, who I think many of you in the room will know, Steve from Massimo, Tim, Michael, and Brandon. Thank you very much. Sit down. I think I'm in the right place. Thank you. So, first of all, if I could start the ball rolling, really, and please ask Vonda just to share with us some of the insights that you've learned over the last few years, particularly since you've been spreading the word of the importance of not just a patient education, but of awareness of VTE within hospital staff.
Well, I'll start by just saying that being in a place like this, which I was a year ago, is inspiring to me. And I participated on the work group and continue to participate on the work group that developed the apps for the HA-VTE. And two things stand out for me on there that I think were very relevant in our case, to be sure. Handoffs are, I think, maybe the 6th apps. Somebody probably has the number on that. We moved 8 times in, and forgive me when I say we, obviously this was my husband's experience. And as a caregiver there 24/7 for 13 days, it was our experience. And many family members and friends, students of Yogi Raja's, one of whom is in the room today. Those handoffs were opportunities, I think, for the kind of communication that I've noticed comes up in topics here. And then I think the piece on the apps that stands out the most for me is having a high level of suspicion. There was no high level of suspicion from my perspective with regard to those 13 days. There were plenty of symptoms. And if, in hindsight, I don't think anybody would look at the medical records and say, oh, well, it wasn't obvious. But as anyone knows, and I don't operate in hospitals. I didn't know anything about healthcare, and I didn't even know there was something called patient safety and that it was as big as it is. I'm glad, but none of that was on my radar. So I think education, and from my perspective, and Yogi Raj spent his entire life focusing on the how do you create the presence of mind to do what we know to, or we think technically, or the data gives us information about, or we know what to do. Systems will improve when we learn how to do it. The presence of mind that we need to have in order to be more transparent, for example. Not let our egoic power nature interrupt the relationship between the caregivers, the family members, and the providers, for example. Those are all things that stand out for me over the last several years.
Okay, thank you on that. I'd like to come back to 2 or 3 of those elements during our conversation, if that's possible. Can I? There's just on this people issue, and it reflects a bit for Vonda's. There's a question here from a brave member of the audience, Amir Haider. And Vonda, I wonder if you could reflect on this first of all. And he asked the question: what can patients do to help prevent VTE? And I guess in this particular context, is what can patients do to add vigilance to the local management of their case? What's your reflections on that? Because you were with Yogi for most of the time.
Yes. A couple of things that have been mentioned. One is communication. I'm a pretty strong person, and I'm not usually easily intimidated. I'll tell you though, I walked into that hospital, and whatever you guys said, I took it as the fact. So I think one thing that patients can do is remember that this is a collaboration going from the beginning. No one in the hospital tried to make me feel that way. I did that to myself. I did it because you're experts, and I wanted to be in a good. I wanted you to do not you specifically, but I wanted the experts to do their job. So I think that's one piece of it. Another piece of it is I think we can publicly educate. I'd never heard of DVT. I had no idea what it was. Yogi Raj actually complained about the mechanical, and I can't say that they were removed because he complained, but I can tell you for sure that if someone had said, this is a life-saving device, that's all the words we would have needed to hear. I would have made sure that every time that PT came in and I got that saddle next to me and we were walking down the hall, as soon as we got back into the room, I would have made sure that that compression device would have gotten back on. So I think that communication and education really go hand in hand there.
Okay, thank you. We started with Yogi Raj. Vonda, I'd like to give you the last opportunity. Can you just talk to us about what you would like the medical and healthcare professional to learn from your experience?
If I think about if Yogi Raj was in the room today, and it had been an error that was caught instead of a death that occurred, I know he would say, pay attention to what you pay attention to. But he had a gazillion quotes, and that was the one that never went into any job without being on a piece of paper. But when I listen to the panelists here and our work group and the work that we've done to this point, I think that it's important to kind of think about what that means underneath. It means what's going on. I was very inspired by Vice President Biden's words, and he basically gives us a playbook, I think, for my work anyway, to really look at what's under the surface. And I'll take a very concrete example in the medical records for Yogi Raj. There's a lot of cut and pastes. What was being paid attention to when a cut and paste happens? I don't know the answer to that, but I would be willing to bet that if we took some time to prioritize our presence of mind, we would be able to identify why cut and paste are a higher priority than writing what's happening in that moment. Why is it that we still have a myth that walking is prophylaxis? It's not prophylaxis, it's a good thing. And I remember the eyes on the doctor walking down the hall. He was so happy to see Yogi Raj walking. Now, he didn't say, you don't have a DVT, we didn't know what a DVT was. But later, I can see these connections. So I think if there was one thing that I know he would leave us with, and that I would want to leave us with, it's to look, in addition to all the wonderful things that we're doing around sharing data and systems, it's to elevate our presence of mind while we're doing that and in that delivery of care.
Okay, thank you very much, Vonda. Thank you.